movement into their sort of diary, so they have this sort of weekly session to look forward to and get involved in. And yeah, we've been going for quite a few years, at least 15 years now, but keep growing. And so we've currently got 27 programs nationally, and currently, yes, 5 in New South Wales. But like I said, we're trying to grow an extra 1 or 2 in New South Wales in this next year. So it's exciting time. We've just put in a bid for Australia to be for us to host the Homeless World Cup in 2026. So we're hoping to get we're not sure where in Australia that would be. The last time Australia hosted it, it was in Melbourne. So we are sort of keen to push that Sydney's the one that hosts it, but that will depend on, how much support we can get from various funders and maybe state government. So that's also an exciting development, something that we're sort of building to in a couple of years' time.
Excellent. Thanks, Jen. Why not Western Sydney for the Homeless World Cup?
Yeah, I think it'd be great.
Maybe Western Sydney Wanderers over there. Did anybody have a quick question?
Yeah, it's Janine here. Jennifer, I've been involved in some research with Sydney Uni regarding non-organised sport, and they wanted to speak with people, and I did mention the street soccer. They were very excited about that, thought that was a tremendous opportunity. It's in my new Healthy Living Options book, so thank you for your input. And as a result, they'll be reaching out to you.
Oh, that's great. Thank you. Thanks, Janine.
Excellent.
Janine, how do we get hold of that Healthy Living booklet?
It's online.
Oh, it's online? Okay.
So is it okay if I send you the link, David, and you distribute that? Would that be okay?
Yeah.
I've also had some hard copies printed as well, so I can definitely drop one in the post to you if you'd like.
Oh, that would be lovely. Thank you.
Brilliant. Thanks, Jen. We'll circulate that with the minutes. So we've got about 27 people. So I'm thinking if you take around 2 minutes to do your little bit, then we'll definitely get round. So over to you, Barry.
Thanks, David. And good day to all the people on this call. So I'll try and keep this to 1.5 minutes, David. Being a national industry association, we obviously have national priorities that we're working on. This year, we're going to be trying to encourage the federal government as part of their budget thinking to fund the physical activity program, encouraging physical activity and exercise across all communities in Australia. We also want them to look at the FBT provisions for gym memberships and so on. We will continue or repeat this year the Fit for Office campaign we ran last year with our politicians, hopefully getting that out to state-based politicians as well, which then creates opportunities for the local member in Western Sydney to get involved, and then for you to be able to leverage that, David, with this group. We're also supporting in the Sunshine Coast of Queensland a regional community activation program with 4 politicians up there. And we're going to be using a concept coming out of Italy called the Wellness Valley, which is like Silicon Valley in the US. This is a wellness valley in Italy where they've been able to track, research and validate that the improvements in the community's well-being mentally and physically because of exercise, not necessarily going to a gym, but exercise and physical activity. Mariana, who is still on leave, will be working with this group, and we've got Jordan on this call as well from AusActive. Jordan's very much involved in these activities as well. So we're having a national focus, but we're really keen to get, I guess, proven in local community activations, and that's what we see with this group, David.
Excellent. I love that Wellness Valley. That's very exciting. Does anybody have a quick question for Barry? Okay, we'll keep it moving. Thanks so much. Over to Scott Walters from Wentwest Primary Health Network.
Thanks, David. Look, here at Wentwest, what we're continuing to do in 2024 is what our overall vision is, which is how do we better connect up the health system? We have a lot of great service providers out there, many of which are represented here today. And traditionally, while we've dealt with general practice for many years, improving capacity and capability there and commissioning service gaps, Recently, that's expanded out to aged care facilities. And what I look forward to in 2024 is that's going to be expanding out to allied health providers as well. So we'll be able to develop relationships and partner more substantially with exercise physiologists, physiotherapists, all our allied health providers in the community out there. What I would be really keen to do is, similarly, David, to what we've done with the Pacifica community and being able to connect them up with services here, I would love to be able to leverage some of the great work here and better connect that with our healthcare providers and other commission services as well. And when I look to, you know, what the big issue has done with the street soccer program, I'd love to hear more about that and how we can connect that in with a number of the other services that we already commission, that might be able to expand that service and leverage some of the community that's already utilizing those programs. So for us, it's about really reaching a broader community and connecting them in with all the resources that we already have. And I look forward to doing that with all of you in 2024.
That's excellent, Scott. Really, really great to hear how you're extending it to more allied health and aged care. Has anybody got a quick question for Scott? Okay, that's good. We'll keep it moving. I'll go to Katrina.
Thanks, David. This is my first call, so I'm excited to be here. I work as a counsellor. I have my own private practice called Reframe Counselling, and this year, very excitedly, I've teamed up with Charlene, who I believe is on the call as well. She runs Advantageous and Parramatta Bike Hub, and we are starting a brand new program called Happy Pace Cycling, and it's going to be all about physical health and mental health together. It's a 6-week program. And so really at the moment, we're just spreading the word about what we're doing. And so David, I'd love to send you that info that you could include to let everybody know what's going on. And Charlene can add anything that I've missed.
Thanks, Katrina. Really, really great to have you involved. Look forward to continuing chatting with you. And obviously, we love the work that Charlene does at Advantageous as a social enterprise in Parramatta. So I'll just pass it along to Nicole Peel from Western Sydney Uni.
Hi, thanks, David. I'm from Western Sydney University. If I haven't met you before, health sciences as an academic. But I guess my year this year will be focusing on particularly social prescribing. So working with David and anyone else in the group and how we can add value to that space, particularly, I guess, for this group from Western Sydney perspective, and really focus on bringing that collaboration together. That's it for me.
Yeah, that's great, Nicole. And I'd just encourage anybody who's interested in social prescribing. Nicole's going to be doing quite a bit of work on that this year. So with a grant from Western Sydney Uni. So I think that's a really great opportunity to look at social prescribing and leisure, particularly. And I'll just pass it along to Janine Dawson. From the local health district.
Yeah, hi. I guess I've got a whole lot of things I'll be working on, but I think something that I think might be of interest to the group is one of the things we've formed a really nice relationship with Blacktown City Council, who are very keen to work more closely with us. And I was thinking one of the things I'd like to do this year is to have a community forum, because we have all these community groups and who are interested in diabetes, how to improve their lifestyle. And I was thinking I'd like to have a community forum here in Blacktown with the assistance of the Blacktown City Council. And it would be great if you could come along and, perhaps, have the opportunity to have stalls and tell people about what you do, if that would be of interest to the group. I think it'd be a wonderful addition and a great way to get the message out both to the council but to also the community groups. We're also looking at a Lose 2 Kilo campaign. That's based on the fact that if someone is at risk of diabetes and loses just 2 kilos, 30% of people won't go on to get the condition. So we're starting with Workers Blacktown and just to see how we go, to get the messaging right. Of course, we're very aware of fat shaming and all that kind of thing, so it has to be a very positive, motivating kind of program, and we're working on that at the moment too. So I think those are probably the two big things that where, you know, other people from this group could be involved.
Wonderful, Janine. Thank you for that. I think that's a great idea in terms of Blacktown, you know, the RSL there and supporting your community forum. I think that's where you were going to host it. I'm not quite sure. Is that right? Is that where you were wanting to host it?
Sorry?
The forum, where were you wanting to host that in Blacktown?
Yeah, I was thinking probably Bowman Hall, because that's a huge hall in Blacktown, yeah.
Yeah, great. Thank you. Thanks so much. And I'll go over to Alexandra Pedersen from City of Parramatta.
Hi, David. Thank you again for the invite to this. This is my first meeting with Western Sydney Moving. So yes, I'm from the City of Parramatta. I am a Healthy Lifestyle Officer with the Active Parramatta Van team. So that's under the recreation field in the City of Parramatta. My team and I, we work at providing free health and fitness programs to the community, so working across the whole Parramatta LGA. And our main goal going into 2024, we're working on wanting to grow our already established community. We've already got a really good base set up, so just looking to expand that even more, trying to filter into a little bit more of the at-risk members in our community, those who don't have as much access. And yeah, just wanting to connect with more health organisations, a lot of the organisation representatives in this meeting as well, wanting to grow our network and put our resources and skills together so that we can achieve more of those health outcomes this year.
Beautiful, thank you. Hopefully there'll be a few more connections for you from today, Alexandra. And I'll go over to another newbie, Mark Dagan, from the YMCA.
Thank you. Definitely not a dragon, but thanks for the invitation, David. It is my first meeting here, so good morning to everyone. Yes, I work for the Y New South Wales as an area manager on the recreational side of the business. So in the Western Sydney part of Sydney, we have centres at Mount Annan, Camden, Hawkesbury, Oasis, a couple of gyms at Western Sydney University, and we've also got a gymnastics centre out at Penrith as well. So we do have a few sites out in the west. We obviously have a few more around New South Wales as well, but I guess for this particular call, those, I guess, are the centres that are probably relevant. In terms of my personal, priorities for 2024, and they're probably aligned with the Y as well, is that we just want to continue to deliver the programs and services to the local communities in which we operate. But we are also looking at growing. So we would like to grow the existing centres that we have, so we have a far more positive influence of members of the community. And then really, at the end of the day, that profitability, that revenue that we generate from those centres will help fund more of our benevolent youth and community activities. So that's something of great interest to our youth and community team. In terms of what this sort of network can do to help the Y, I think really probably just sharing and promoting our benevolent youth and community activities so we can help make a positive difference to everyone. That's it from me. Thank you.
Thanks, Mark, and it's great to have the Y involved, because I think leisure is one of the areas we lack a little bit with this group, and we've got club links, but it's great to have Y involved now. So thank you for joining. Over to Indy Rose from ACPE.
Hi everyone. So as David said, I'm Indy Rose. I'm the Careers Advisor for the Australian College of Physical Education, located in Sydney Olympic Park. And my main priority today is to look at organisations such as yourselves that are interested in offering internships and work integrated learning opportunities to students. So some organisations here have already taken students on, and it's been a really wonderful experience. Mariana from Oz Active took on a student last semester, and it was wonderful. And we've also had some students go to the Active Parramatta van. So yeah, and it's been really great. I'm hoping to, so I just wanted to raise two particular subjects that we have coming up this semester. So starting in April, we've got raising health awareness. So this is a health promotion subject. It's 45 hours of placement over about, I think it's 7 or 9 weeks. I can give people the exact dates if they need them. But essentially, students just need to be working in an organisation that is doing health promotion, and students can kind of assist at any point of the program, planning, delivery, etc. In addition to that, we've also got building relationships in sport business, which is a sport business work integrated learning subject. So this is more of an introductory subject that's 40 hours, again, taking place in April. And where basically this might be a better one if, for instance, your organisation doesn't maybe do health promotion, but is still in, you know, the health space and has a project they'd like to work on, and that they could use some assistance with the student. So those are the work integrated learning subjects, the main ones. If anyone is interested in something a little bit longer term than maybe 40 hours in that April-May space, then please also let me know, because I am kicking off an internship project or program, and I would love to chat. Thank you.
Beautiful. Thanks, Indy Rose. I'm sure we'll have organisations that'll be interested to hopefully partner with you. Alana Romero from the local health district, Southwestern.
Good morning, everyone. Hi, I'm Alana. I'm a health promotion officer from Southwest Sydney Local Health District. So I'm currently in two roles. So I'm in, or will be going into our school years program from the end of this month. And then I'm also the program manager for our Go for Fun program. So going into 2024, we really want to promote our Go for Fun program, which is a free 10-week program aimed at children and families. The minimum requirement is that families need to have a child between the ages of 7 and 13 above a healthy weight. And the whole aim of the program is to encourage the whole family to adopt small, sustainable changes to live a healthier lifestyle with healthy eating and active living. So that's kind of what the next 12 months will look like for us. Plus a lot of other work, but to be confirmed.
Fantastic, thank you. I love that program. Go for Fun, obviously free, so it's a great opportunity to get more people active. I'm going to go to Jonathan Vermanis.
Thanks, David. Hi, everyone. I'm Jonathan. For those who haven't met me, I'm from Diabetes Australia. In my current position, I'm the Beat It program manager. So we deliver an 8-week exercise program for people living with diabetes all across Australia. In terms of 2024 focus, obviously keeping this more so to Western Sydney, and what we can do within the community there. Our aims and objectives are always to try and get as many programs out as possible to as many people who live with diabetes as we can. Western Sydney is an area in particular where we know there's quite a high density of people living with diabetes, and it's somewhere where we personally obviously want to try and set up as many programs as possible. So whether you have any sort of exercise professionals that you might know of who might be looking for something like this, or any opportunities where we might be able to collaborate in getting a funded program out there, or anything that we can do to work together to obviously increase awareness and education around the diabetes space, it's something we'd be more than happy to be involved with. I know there's some people on the call here that we work with quite closely already, but you know, if it sounds like something you might be interested in, I'd be happy to get in touch and have a chat.
Thanks, Jonathan. That's excellent. Thank you. I will go over to Christina Capiccioni.
Sorry, I just realized I have my microphone on. Hi, everyone. I'm a professor here at UTS in Sydney, and been doing a lot of community-based physical activity work for a number of years. I have a number of projects currently happening throughout Western Sydney and Sydney in general. But some of the exciting ones that are, well, they're all pretty exciting, but some of the ones that might be of interest or would love to chat to people about is we are just kicking off a partnership with Cricket New South Wales, where we've developed a men's health program, and the men's health program will be around physical activity, but also around mental health and mental fitness. And our obvious activity will be around cricket, and it's focused on South Asian men in Western Sydney. So we're working with Schofield's Cricket Club as well, and many other community partners in that area. And like I said, that's really focused on men's health. Another project we have too that's gained some great momentum is we're working with the Kari Foundation, and it's called Tita Talk. It's a healthy lifestyle and physical activity program for Aboriginal adolescent girls. So we've run a number of the programs for the last 2 years, and we're getting some really great momentum with that, especially within schools. So that's happening too. And pretty much there's some other ones, but those are some of the basic ones that we're working on currently. And we have a number of projects here. We have a number of opportunities for students. Similar to India Rose, you know, we have many students too that would love to have internships, or many of our students are around sports science, but now that I'm the black sheep here and I've kind of forged this health promotion and physical activity avenue, a lot of our students are moving into that area or are interested in that area as well. I think, oh, and a very important project too that I'm working on with David and one of my colleagues, Oscar, who leads the project, is working within the Pacifica community, particularly women. So that's been really exciting, and I've learned so much about that in the last year. It's been great. That's about it.
Thanks, Christina. Good job. I will just move it over to Rona McNiven from UNSW. Hi, Rona.
Hi, David. Hi, everyone. This is also my first meeting with the community of practice today. I'm excited to get involved with what seems like a really dynamic and interesting group. So I'm a senior lecturer and researcher at UNSW. UNSW is based in the city in the east. That's also where I live on Bidjigal land, but also has a campus presence at Liverpool. It's similar to Christina. I'm involved in quite a few physical activity and health promotion programs and research evaluations in Western Sydney, either in Western Sydney specifically, or larger scale projects that have an important presence and involvement in Western Sydney. These include the Young, Strong and Deadly program that Andrew Fraser presented on to the group last year. I caught up with that recording. And Creating Chances, youth development through sport, the Ironbark Falls Prevention Programme for older Aboriginal people, the First Lap Learn to Swim government policy programme. So I'm just keen to continue the progress of those research projects this year, and connecting with groups like this to ensure that we're reaching people and professionals who are working more on the ground than we might be in universities. So really just to find new avenues to share findings, plan future projects, and connect with people who can help realise the impact of research in improving people's lives. Thank you.
That's lovely, Rona, and welcome. Please, you can join the group. I'll just throw it over to Alison Dunshire.
Hi, everyone. Happy New Year, everyone. I've got a few changes happening this year. I myself have just accepted a new position in the Blue Mountains, so I'll still be in Western Sydney. But it's been moving there starting in February, so that will be manager of healthy places at Nepean Blue Mountains Local Health District. So that's exciting. And with that, I will be taking one piece of work that I'm working on with the Western Sydney Health Alliance, which is the walking and cycling strategy for the Health Alliance. So that will come with me. So that's an exciting piece of work that we're doing with the councils in the Western Parkland City, the 2 local health districts and the 2 primary health networks, and that's looking at a really broad range of strategies and actions to focus on walking and cycling. So it includes obviously planning and designing the environments for walking and cycling. It's looking at building those environments. They're not just planning them, but actually delivering them on the ground. It's also looking at encouraging people to walk and cycle. So that's the messaging side of it as well. And then the other aspect to that is working together to deliver walking and cycling policy and legislation, investment in walking and cycling, and also the evidence. So it's extremely broad, but the delivery focus is obviously for the Health Alliance, it's councils, district and primary health networks. So they're the organisations, but we're also looking very broadly at all of the other organisations that are involved in walking and cycling in the Western Parkland city. So we've had Transport, we've had Bicycle New South Wales, Heart Foundation walking groups. So any of those that deliver walking and cycling on the ground in those council areas. So yeah, I'll leave it there.
Such a great initiative, Alison. Excited about that one, and congratulations on the new job. I'm pleased you're still going to be as part of the network. I'll go over to Karen Wardle, and before you jump in, I just want to say thank you, Karen, for the symposium where you jumped on as one of the panel members at really short notice. Really appreciated that.
No problem, David. I am the Director of Health Promotion here in Southwestern Sydney Local Health District, and congratulations, Alison, we will miss you, but Nepean Blue Mountains will greatly benefit from your expertise. Some of the work that Health Promotion will be doing is, I guess, helping support a little bit of what Alison just said around, we know the 8 councils in the Western Sydney Health Alliance already do have some great walks, so we'll be looking at supporting them with their current walks and their recreational walks, and just trying to get a little bit, I guess, more visibility around some of those across those 8 council areas in the lead up to some of the work Alison will be doing. We also will be having a focus on families in Southwestern Sydney, so some work around low cost physical activity and some work with some of our families specifically in a bit of a co-design approach. And also some work on screen time, which we know is a big issue as well. So supporting families with trying to limit some of that screen time. There will also be some work that will be continued with Park Walk. So we have been working with the Park Run organisation to increase the Park Walk component of that, and particularly focusing on our cold communities. And we've had, quite good success over the last 12 months with some engagement around that. We also are developing an app for local walks. So we're in the user interface stage of that, where we're putting some local walks up onto an app and getting that piloted across one of our local government areas, hopefully to roll that out later in the year. And then some of that work, David, around healthy ageing. So the ministry funding for healthy ageing has changed. So it's not a pure falls prevention focus now, it's more around health and wellbeing. So we've been working with David on the Linnea piece of work and trying to incorporate a bit of that mental wellbeing approach into that as well, and the 5 ways to wellbeing. That was super successful. So we're hoping to be able to roll that out and continue that work with David as well. That's probably about it for me at the minute.
Thanks, Karen. Appreciate that. I'll keep it moving because of time. Over to you, Raj. In a car, I think.
Yeah, no, that's okay. I've parked, so I'm not driving. Raj, I'm the General Manager of Urban Rec Western Sydney. We run social sports for adults, and we've been doing it all across Sydney for the last 10 years, not just Sydney, but Australia. Over the last 2 years, it's when I pushed it to Western Sydney, because that's where I kind of grew up. Last year, we set up base in Parramatta, Blacktown, the Hillshire, and we're running Australian favourite sports such as netball, soccer, basketball. And then we touched a bit down towards Liverpool, and we ran flag gridiron, kind of jumped on the hype that flag gridiron's going to hit the Olympics. And so coming into 2024, we're looking to keep going on what we've already built down in the Penrith region, Parramatta, Blacktown, and then hopefully come closer to Cumberland and Liverpool and run social leagues. It's more for adults only, 18 plus, looking for a fun time. It's very social, beginner friendly. You play a game, you kind of leave. There's no excessive training. It's a kind of welcome environment for a lot of people. We also work with an organisation called Access Social Sports, and they're bringing in social sports for teens. So if it's 16 to 18, and we're looking to bring a few of those leagues down south. So I'm hoping for this group I can find get in communication with some councils or organisations that might have some venues for hire, looking for some same type of demographics of 18 plus type of adults, looking for a social environment and a new way of meeting new people and having a bit of fun. So thanks again, David, for this.
Yeah. Thanks, Raj. Excellent. And Jordan Kidd, also at AusActive.
Hey guys. Again, thanks for obviously for putting this on as well. But Barry did a pretty good explanation about all the things that we'll be working on this year. So I'll save some time for someone else.
Thanks for that, Jordan. Over to Helen Cooper. New South Wales.
There we go.
Hey.
Hi everyone. Thanks David and the team for the excellent symposium at the end of last year. That was just a really great chance to hear about what everybody's doing out there. I'm a project manager for Outdoors New South Wales and ACT, which is the peak body for the outdoors in New South Wales and the ACT. And we advocate in the spaces of outdoor recreation, outdoor and adventure tourism, nature therapy, and pretty much anything outdoors. And my role has been working on a program called the Active Outdoor Kids program, which provides a fully funded outdoor recreation program for young people in the Greater Sydney region and in the northern region of New South Wales. But our funding is running out, so we're actively looking for further funding to continue delivery of this program, which has provided some really great outcomes for young people and for businesses who've sort of struggled following all the, compounding disasters of the past few years. Another hat of mine is I'm currently a Masters of Philosophy student in education at Western Sydney Uni, and I'm doing a research project on integrating place-based outdoor experiential learning into schools to enhance student well-being and school engagement. So if anybody has any kind of school connections or interest in this area, I'd love to chat with you as well. So I'll throw my couple of email addresses into the chat and please get in touch. Thanks.
Thanks, Helen. That's great. That's loving that program there. Maria, I'll go over to you. Another newbie for today.
Hi, David. Hi, everyone. So I'm Maria from Canterbury Bankstown Council. My role is the Active Ageing Officer. So I met up with David last year at an interagency forum. I've been trying to put together programs for seniors and also look at what's already there in seniors. We've got a lot of seniors that run their own sustainable programs through senior centres. So we've currently started putting a booklet together each term with all the programs that are available, both run through council and both through the senior centres. I'd love to meet up with other people here that are either looking for rolling out some research stuff in the southwest Sydney, so the Bankstown area, Canterbury Bankstown, and if there's any partnership we can work, we're always looking for more stuff to offer our seniors in the Canterbury Bankstown. David's got my details, so yeah, I'm happy to chat with people.
Thanks, Maria, and we will provide everybody's details with the minutes as well as everybody's overview of what's going on for 2024. Over to Heather Martin.
Hey, this is also my first meeting. I actually only heard of this network a couple of days ago. Thank you, David, for connecting me. So I work for New South Wales Health in the mental health inpatient wards in Western Sydney. I guess my aim for the year would be to just, wherever possible, address the life expectancy gap for our consumers. So it's up to about 10 to 20 years lower than the general population. And unfortunately, it's only increasing as the years go on. So we're not actually addressing the problem enough. So I would love to be able to connect any of the mental health consumers with any programs that they can continue once they've been discharged from the hospital, or even for leave while they are in the hospital, because a lot are long stay consumers that we're just trying to connect with the community. So I've been making a massive list and I'll put up my email address so people can send through to me as well, because I am very, very keen to get the at-risk people connected with things.
Thanks, Heather, and for jumping on at such short notice. Over to Ali Dench.
Oh, g'day, David, and Happy New Year to everybody. Hope everyone's nice. Sounds like everyone's really recharged for 2024, which I think is awesome. The Western Sydney Health Alliance, heaps happening this year. You've heard both from Alison Dunshire and Karen Waldell on two big projects that we're helping to push along, and that's the walking and cycling strategy, and also the use of outdoor recreational spaces and the app development, which is awesome. But our main focus is on policy and strategy development and ensuring there's a health lens put over any initiatives and strategies and policies that particularly the councils in the Western Parkland City are implementing, and making sure we're also working with universities that research and evidence-based findings are incorporated into the on-the-ground activities and initiatives. So we're also, other big focus this year is around council's integrated planning and reporting frameworks that are being reviewed, and making sure that there are health outcomes. Councils and organisations talk about wanting health outcomes. Well, we want to make sure there is something tangible in the plans that's going to make things happen on the ground. So we'll be doing submissions to each of the 8 councils through their planning process to ensure that there are let's get moving activities happening, making sure there's health initiatives happening. We also do a lot of advocacy. We be updating a lot of our advocacy. We've got briefing notes, stats and data on our website that anybody can tap in. Happy for people to cut, paste, use them in your submissions. We're here to help you with any submissions you may want to be writing, and you need evidence-based, health evidence-based information about Western Sydney, we can help you with that. So I'm really keen and eager to push along how we can get a health lens over everything that we do, but a tangible, practical approach for things happening on the ground, and working with community who want to make it happen for themselves as well. So yeah, I could go on, but I won't, David. But Happy New Year to everyone. Looking forward to working collaboratively with everyone this year.
Thanks, Sally. I lost contact a little bit there, so sorry if my screen's going a bit funny. So, but we'll continue. Over to you, Jared.
Oh, hello, hi, David and all. I believe Jennifer's already spoken about the big issue, so I won't reiterate. But yes, I am one of the coaches on the ground. So I delivered a program at Parramatta and West Domain. So I'll be there from 3 o'clock today, 3 till 5 o'clock. And I don't know what else I can add at this stage, but yeah, it's a fantastic program. We're growing in numbers and very much with yes, participation in sport, but more very much on focused on delivering health outcomes and building social connections. So yeah, it's an amazing program. I'm so happy to be involved in it, and would love to have any other agencies come on board to help us build and grow it and connect further people so they can benefit from what we do.
Thanks, Jared. Appreciate you jumping on as well. I will go over to a few that haven't got their screens on. So over to you, Craig Lambeth.
Turn my screen on.
That's good. Good to see you.
Yeah, thanks. Yeah, look, I'm only just back in the office after leave, so if I sound invigorated, it's because literally I walked in the office and dialed into this meeting. And I didn't know you were back. Are you you're in London still, or are you back?
Back in Australia.
Yeah, beautiful. Well, thanks everyone. Look, I work for Liverpool Council. My title is Manager of Recreation and Community Outcomes, which gives me a sexy portfolio of a whole bunch of stuff. But for the purpose of this discussion, I suppose the portfolio of recreation, leisure, sport, leisure centres. So, Mark, give me a call. Yeah, so it's a fairly large portfolio. But look, our broad objectives are to maximise participation in organised and structured sport, leisure, recreation activities across the LGA. That's sort of the high-level statement, I suppose. Within that, there's some really key objectives. Maximising participation by marginalised populations of our community, I suppose, and trying to achieve gender equity and sport participation. And look, there's a whole bunch of actions within that, as you'd appreciate, everything from the research to identify barriers and the plans for removal, blah blah blah, infrastructure development, partnerships, and so forth. I won't beef it up too much because I would suspect it's really not marginally indifferent from any other local government area. But the really key things for us at the moment, we've got 250,000 people in our LGA, and by 2036 we're going to have closer to 400,000, and with that comes a whole bunch of growing pains and infrastructure delivery strategies, which is probably our main focus at the moment. There you go. That's it. That'll do.
Thank you, Craig. And now your first meeting of the year. What better than Western Sydney Moving Community Practice?
You set the bar very high.
I will go over to Oscar Lederman.
Hi everyone, my name is Oscar. I'm an academic at UTS. I work with Christina. I also work with David through some of the community-based initiatives that we've been working on. Christina plugged the Pacifica Moving initiative, which is based in Mount Druitt, which is a really exciting one. We've done 2 Talanoa sessions, which is the Pacifica term for having a conversation. It's essentially having a yarn, but we've evaluated that and got some really good, really fruitful information from mainly Pacifica mothers, which we will then convert into an exercise program. To sustain it though, we're going to be looking at funding opportunities going forward for the rest of the year. So local Western Sydney based grant opportunities, please send them my way. I'll be actively applying and seeking ways to make this program more sustainable, because it's a huge need for this community and they're really keen to build and grow. I'm working on a bunch of other projects as well. My history is working in mental health units as well. Someone else was working in Western Sydney. I was working in Southeastern Sydney, LHD, and had a bunch of overlap with collective leisure and what David's done with some of the community-based initiatives there. Thanks for having me, David.
Thanks, Oscar. I'll just go to Lauren.
Hi there. Hi, David. This is my first time here. Thanks for having me. I'm from the Royal Australian College of General Practitioners, and I'm the manager of the Healthy Habits digital health program that involves a patient-facing app that's connected to GPs, and it supports patients to develop habits around physical activity, nutrition, and sleep health. We've been recently officially launched the program, and we've got some new funding, which is fantastic. And our focus really is to now look at partnering with organisations to really support integration and to focus in on particular areas and areas of real needs. So I'm really interested. There's so much great stuff that's happening. I've been writing so many notes, but I'll love to see the meeting notes, David, so I can sort of think about all the opportunities there. But I'm very keen to talk to people who are working within primary care and how we can support healthy habits within primary care, but also that social prescribing element as well. So how we can also promote those options within our tool for Western Sydney. So I'll leave it at that, but yeah, thanks for involving me. It's great to be here. Thanks,
Lauren. Welcome. You're very welcome. And we've got about 8 minutes left, so I want 5 minutes at the end just to give you a little overview of the symposium. So if you could just keep it to about 1 minute, that would be good. Charlene, are you there? You're probably on a bike.
Not yet, but I will be very soon. Hi everyone. I've started the year off with flu, which I haven't been sick in something like 3 or 4 years, so I'm just trying to get back into it. The Community Bike Hub this year is looking at a circle of friends for our strategic planning. And as Katrina mentioned earlier from Reframe Counselling, we are launching our Happy Pace cycling program, 6-week program. So trying to reach out to more people, getting them onto the bike and gathering the benefits of slow riding. I'm hoping to grow our membership for our community bike library. We have over 100 bikes in the library ready to roll out now, and that's been well used over the last 6 months in particular. And last of all, Her Cycling Connections, we are starting up in Blacktown local government area. So that's us
Oh.
in a nutshell for this year.
That's exciting, Charlene. Excellent. Elizabeth, Hannah?
Yes, thanks so much for having me, David. I work for the Heart Foundation as part of the walking team. So I'm the program officer for New South Wales and ACT. And in a nutshell, my role aims to increase engagement in the Heart Foundation walking program, support the existing network of groups in ACT and New South Wales, and work on partnerships with similar organisations. My focus this year is increasing engagement specifically for Indigenous and CALD populations and areas of disadvantage. I do actually have something happening in February. So I'm working with David Perez, who's also part of this network as well. He works for Starts, and we're doing a pilot project running a walking group for Arabic and Spanish speaking clients. So we're going to integrate health messages into each week of the walking program. So it's also going to have an educational aspect. So drinking more water, healthy foods, as well as that physical activity and social connection. So yeah, that's what I'm working on this year. And if anyone is interested in finding out more, please feel free to contact me.
Thank you. That's excellent. Have I missed anybody? No? All good? Okay. That has really energized me. I don't know about anybody else, but it's fantastic to hear about what's on the board, and only a little of that, I suppose, of what's really going to be happening. But thank you for all sharing. So yeah, in November last year, we held the inaugural Western Sydney Symposium, and this was really a culmination of the last 15 months work of the community of practice and building the network and trust and relationships. And the event was dedicated to tackling inactivity and inequalities in Western Sydney. And it was from my perspective, quite overwhelming really to have such a cross-sector, I suppose, cross-sector organisations that attended. We actually had 104 delegates in total, across 12 sectors that were represented. So academia, education, government, health, leisure, local government, non-for-profit, peak bodies, pharmaceutical industry, private enterprise, social enterprise, and sport. Which was really cool because we're trying to look at a whole of system initiative and trying to bring those different stakeholders to the table. We had 30 speakers, so we did pack it in, and a lot are on the call today, so thank you. We don't have time to mention you, but do really appreciate the support. One of the questions we asked was, why does moving matter? And there were 6 key themes identified. Number 1 was well-being and mental health. Number 2 was physical health and longevity. Number 3 was social connection and community. Number 4 was enjoyment and fun. Number 5 was holistic and independent living. And number 6 was personal empowerment. Now, I know I'm running through this quickly, but I will provide this to everybody as an infographic. There was 3 top delegate priorities, because we held a Slido session throughout the event. Number 1 was community engagement and advocacy. Number 2 was health promotion and preventative strategies, and number 3 was policy and infrastructure development. We did ask delegates what was the one thing that was missing from the symposium. And it was quite clear that the number 1 priority for people was the engagement with policymakers and politicians. And I did reach out to a number of local members, but unfortunately they weren't able to make it on this occasion. But I think that's definitely an area for us if we're going to scale our movement. Some of the next steps. Over the break, I've been drafting a Western Sydney Moving white paper, which is basically going to talk about the journey over the last 18 months, who's involved, the case for a whole of systems approach, and why we're trying to do this in terms of the physical inactivity problem, and then the symposium as well. And that's being peer reviewed by colleagues on this call from UTS and Western Sydney Uni, and we're hoping that's going to give us some oomph in terms of being able to lobby and advocate for some funding to progress this. We're going to look at exploring Western Sydney moving to becoming a health promotion charity, so not an initiative of collective leisure as it is at the moment. And I know I've mentioned this a few times, but this is pro bono because, you know, for a lot of us, we really believe in this. But if we can build a health promotion charity and then we have skin in the game by the organisations that are on this call, then I think that then that seems to be a way forward. We're looking at investment and a strategy. So we're going to host a day later this year where we're going to bring colleagues together again to look at what that might look like. And there was an overwhelming response to convene a Western Sydney Moving Symposium in 2024. So we're looking at a date for later in the year, and we'll provide more information on that. Well, thank you, everybody. Really great to see you all. Happy New Year, and look forward to working with you all in 2024. And yeah, we'll see you soon. The next community practice will be in 8 weeks. So take care. Talk soon.
Thanks, David. Thanks, everybody. Have a great
See
week.
ya. You too.
Bye.
Bye bye. See you soon.
Thanks, David.